Hello, everyone. Good afternoon. I'm from Ghana, so it's afternoon here. I don't know where you're watching me from, but wherever you're watching me from in your time zone, I extend my warm greetings to you. My name is Daniel Gyimah, and I'm a diagnostic radiographer in Ghana. Um, this is my first video on this channel. In fact, the YouTube channel was created just about I think a week ago. It's not even up to a week. I think I created it just last Tuesday or so. Yeah, and then my first video was just an introductory video. It was just an animated video of my logo. Yeah. So professionally, this is my first video, and I'm making this video to explain why we created this channel, the need for it, and then what the plans are. So primarily that is it. Now, as I stated earlier on, I'm a diagnostic radiographer. I created this YouTube channel for a purpose, a very important one. Now, radiography is a field of medicine in which ionizing and non-ionizing radiations are used to produce images of the internal body structures of the human body for diagnostic purposes. I'm just amazed that this definition is still on my mind right from level 100. Anyway, that's fine. But it's the simplest of definitions that you can get for radiography, of the term radiography. So it's a field of medicine. Radiography is a field of medicine. And there are two main ways of diagnosing a disease when you go to the hospital. So there is the lab requests, then there is the imaging. All right. So there is a different field, which is laboratory science, which has to do with using chemical reagents on body fluids. It could be blood, it could be urine, it could be mucus, it could be stool, to initiate a reaction. All right. So when there is a reaction, it means something. The observation you get means something. So if the observation you're getting means that there's a presence of a pathogen, then it means that there is. All right. If otherwise, then it means there isn't. So we have the laboratory test on one side. Then we have the imaging, where we see for yourself. You see for yourself what is actually happening. Now with this, you can have, different forms of imaging. We can have endoscopy. All right, endoscopy, where we use camera, a modified camera, into the body, and then it's able to see what is inside the body. You see it on the screen, and then you're able to tell what is wrong with the person. Now, what I'm interested in when it comes to the imaging aspect has to do with radiography. That's the field we call radiography. So here we are looking at using ionizing and non-ionizing radiations. And so just a quick one. When you talk about ionizing radiations, you're just looking at the group of radiations, all right, that are able to produce ionization. Now, ionization is simply the forming of an ion. In simple terms, forming an ion is ionization. So the process by which ions are formed due to the ejection of electrons from the outermost shell of an atom. All right. So that concept, there are some particles, there are some radiations that are able to cause ionization. They're able to cause the outermost electrons in the outermost shell of atoms to be ejected. So for example, we have X-rays, we have gamma radiation, we have an alpha particle, we have beta, we have the neutrons, we have the protons. All these ones can cause ionization. So we call them ionizing radiation. Then we have the others that are unable to cause ionization. So in other words, they are unable to cause the ejection of electrons from the outermost shell of electrons, in simple terms, right? So we have ultrasound. Okay, so we are not just using sound, we are using ultrasound. We also have radiation produced from magnetism. All right, so we use magnets as well to also produce images. So primarily, these are the various modalities. Now, when I mention modalities, I'm looking at the machines that are used in the field of radiography. So we have the general purpose X-ray machines, Those ones we call them general purpose X-rays because they are used for many, a wide variety of imaging tests. All right. Then we have computed tomography. Now, this takes images in slices. You will see the images as I'm speaking. So we can have computed tomography. It takes images in slices, right, in cross sections, so that you'll be able to assess a full section of the body in many sections or in many views, all right, and projections. Then we can also have MRI, or magnetic resonance imaging. And mind you, before I forget, the computed tomography also uses X-ray. So it's just a modified X-ray machine which takes images in slices. As simple as that, right? Now for the MRI, otherwise known as the magnetic resonance imaging, that uses magnets. So it uses a very huge magnet to produce images. The concept or the process by which images are produced with these MRI machines will be explained later on in some other videos. But for now, we understand that we have a general purpose X-ray machine, we have a CT machine, we have an MRI machine. We also have what we call the fluoroscopy machine. This is more or less like a video format. So we could see the images in real time as they are moving. You could see the objects in real time, the part of the body in real time. That's fluoroscopy. We have then, aside that, we move into the specializations where we can have mammography, which is used for the breast. For breast examinations. Yes. Yeah, so that's it. So these are some of the modalities that are used. There are other two modalities that are not. In fact, we don't have any of them yet in Ghana, and even in the whole country, in the whole world. There are just a few of them in some developed countries. We have what we call the PET, otherwise known as the positron emission tomography. Yeah, positron emission tomography. Then we have the SPECT, which is the single photon emission computed tomography. So these ones are there. And then their mode of operations are all different. That's it. So as we have said, radiography, from the look of things, is a very broad field of medicine, and I agree. Now it employs three major sciences. We have the anatomy, we have that is the body framework of an organism. So the anatomy, it can be used as an English term. So we just look at the anatomy of the body. We're just looking at the blueprint. So you're looking at the plan, you're looking at the various sections of the house. All right, now if you look at anatomy of the human body, you're looking at the body framework. So what are the parts? So anatomy, very important. We look at physiology, which is how the body functions, and then we also look at pathology. That is, the differentiating the normal from the abnormal. One of my lecturers used to say this, Professor Guliku, wherever you are, thank you very much for such insightful statement. It impresses on my mind so much. Now, what he said was that you should be able to know the norm. Now, if you're able to know the normal, then you can differentiate the abnormal from the normal. So, for example, you know how the liver looks like, you know how the kidneys look like, you know how the lungs, you know how they look like. So when you see a diseased lung, you'll be able to identify, no, this is not normal. You know how the thoracic cage looks like. So if you see that there is something wrong somewhere, then you know that, no, this is not normal. Then you go in to find out the cause of such a problem. So very important that you should be able to know in depth anatomy, physiology, and pathology in order for you to become a very good radiographer, and in fact a diagnostic radiographer for the matter. Now, before a radiological request is made, they are made through the use of a request form, radiological request forms. Now, these requests are very technical and must be understood. In fact, it's only meant for those with technical eyes that are able to identify what sort of examination you're going for and then the need for it. For example, when you go to the hospital, you're sick, you go to the hospital and then a prescription is given. Most of the times you're unable to read the prescription, right? But if you give that prescription to a pharmacist, the person can tell you, you need this, you need that. It's this and that the doctor has requested for. So just because you don't have the technical eyes, that's it. So radiographers do not only have to know how to produce the images. So you'll be able to produce the image of the chest, you'll be able to produce the image of the of the abdomen, you'll be able to produce the image of the lower leg. It's fine, but that's not it. You should also be able to know and understand request forms. Now, this is just a personal experience during my clinical training years, from first year to third year. In fact, the challenge I was having, and I'm sure many of my colleagues who also identify with this same sentiment, has to do with being able to correlate patient clinical history with radiological requests. I mean, it was such a difficult task for many of us. And sometimes you're put on a spot. There's a request form, you read the history, the request, the radiological request, and you are asked, so why do you think the doctor is requesting for this? I mean, what's the correlation between the history? It's a whole lot. Sometimes it's just so uncomfortable being in that situation. But fortunately for me, through practice, I was able to overcome such challenges. And then, even though I can't say that I know everything, but at least the major ones, and then some of them you can just even apply the previous knowledge that you know. So in view of this, I created this YouTube channel to explain request forms, radiological request forms, clinical history, request, expected outcome, relate all those ones, you correlate all of them. So primarily that's the purpose of this particular YouTube channel. So it is in two folds. Every week I'll release one video explaining one request form. So I'll pick a request form from the facility that I work with. Of course, I'm not going to show the patient's sensitive information like patient's name, patient's ID. I'm not going to show that, but I may need to show the age. I may need to show the gender, because it may have to know those ones to help in some of the analysis that you make. Now, even though this channel is dedicated to explaining radiological requests, it's not just that. So what is happening is that I also explain certain concepts in radiography, certain concepts in radiology, or certain concepts in healthcare in general. All right. So for Mondays, I'll release a video explaining one request form at a time. Then on Wednesdays, I'll release another video explaining one concept in healthcare. It could be anything at all. There's a whole lot of. I think there was this argument. I heard somewhere. I think I also shared the same sentiments some time back that not eating causes peptic ulcer. I mean, who knows? It could be the very first video in that particular series. So we look at those things like that. We can also look at concepts like I spoke about earlier on, the operation of the modalities, some of the modalities like the MRI, how are MRI images produced, and then stuff like that. Maybe one of these days I can take you on a tour to my facility, and then I will show you around the place. I think it would be a nice experience. Don't you think so? Yeah, I think so. So I'm very happy, and I mean, it's great to begin this milestone with you. What are you? All that I need from you is that whenever a video is posted, kindly share it. Turn your notification icon, turn it on, so that as soon as I release a video, you're gonna see it. Share with your friends, like it, comment. If you have suggestions, you can. If you have questions, you can just comment them below. And please note that all the information that will be shared here are well researched and approved by my supervisors. It's vetted, as some people would say, vetted and approved by my supervisors. Anyway, that was just by the way. So the very first video in the lesson series will be released next week. Yes, it will be released next week, Monday. Then from that time onwards, on Wednesday, I'll release another video explaining basic concepts in healthcare. It could be how to even check your blood pressure. I mean, explanation on that and why they do it. It could be so that is it. So thank you very much for your attention, and I hope that you enjoyed this video. Please comment, please like it, please share it with people, and please, most importantly, subscribe to my YouTube channel. My name is Daniel Gyimah once again, and I'm your Diagnostic Radiographer on YouTube. Peace out.